So I firmly believe that the Aurora Zip device is very unique in how it can treat lumbar spinal stenosis and also be able to induce a lumbar spinal fusion. It does it in a very minimally invasive way, and it's actually very unique in that multiple physicians and specialties are actually able to use this product in their practice. So one of the reasons I wanted to be part of the education program is because I think this is something that is landmark in our space and in the treatment of lumbar spinal stenosis. And I wanted to actively take part, make sure that physicians were adequately trained to put these in their patients and implement it into their practice. I think probably what drew me the most to the Aurora product line is that it's all minimally invasive approaches for pain syndromes that we've been treating in the chronic pain space for quite some time. And we haven't had these type of treatment options. There wasn't many options between just conservative measures such as injections and then traditional open decompression and fusion surgery. So this is actually a device that actually bridges that gap and allows more patients access to having these therapies. It's absolutely true for both Zip and Silo for treating lumbar spinal stenosis as well as in SI joint pain. I think SI joint pain, especially being treated with the Silo devices, SI joint pain has been highly undertreated and under-recognized for quite some time now. And I think now this is opening the door for a lot more patients to be treated, and the pain syndromes that it leads to has been, I think, misdiagnosed for a while. These patients haven't had access to therapies, and now actually having a minimally invasive approach to treat this, I think is just paramount in improving the space. I think the best way to describe the Aurora team is it's a family. The company started off small with a small product line that they would contract out, but have now brought everything in-house and have really continued to innovate the technology and continue to improve on it. They don't rest on their laurels, and everyone works together to make sure that we can bring these therapies to the forefront. It's not easy being a startup company or having a new product that's even landmark in the space to make sure physicians are properly educated on it and research is being done on it. But I think Aurora has really backed their devices and continues to push the field forward. I think honestly it's all the national training events to see a lot of the young physicians or even established physicians coming through and learning this landmark therapy and seeing how well it can treat patients and be implemented in your practice as a minimally invasive approach to bridge that gap between conservative measures and large open surgery. I think it's just great to see how physicians now realize that there's so many more tools in their bag to treat these patients, and that there's a large amount of patients who were not being treated, patients that were older with medical comorbidities or those who wanted to avoid traditional open surgery now have access to a therapy to take care of them. I think I would love to continue to see expansion and more use of the devices. I know that in the pipeline there's a further innovation on devices that they already have, such as the Silo, as well as the Zip device. I think the most important thing for the company and just for the future of our space with this is to continue to implement research and prove that these devices work and that they also work in different physicians' hands. I think a lot of it is just in education, making sure they understand how the product works, make sure they understand the type of patients that they're treating, but also understand that there is actually data now out there that shows how well these devices work, that they're minimally invasive, that they are very safe. They're also very safe in interventional pain physicians' hands, and we have data that supports that and is published. So I think the most important thing, as I said, is just in education, both in the research, the surgical skills, and knowing what type of patients to choose for this. What's very unique about the education platform for Aurora is that they're bridging that gap between interventional pain physicians and spinal surgeons, where these therapies can be implemented by both of these specialties. And by doing that, it's actually bridging the gap between conservative measures and traditional larger open surgery. And what that does is it allows more patients access to therapies to treat their lumbar spinal stenosis, their sacroiliac joint pain, which normally they would not have been capable of having a therapy. So one of the things I think is great is that Aurora has now funded and implemented a multi-center study prospective looking at the Aurora Zip device to treat lumbar spinal stenosis. It's called the REFINE study. We've been enrolling now for 1 year and have many active sites. And it's basically following both the safety and efficacy of utilizing this device in both interventional pain physicians' hands as well as in spine surgeons' hands.